We're going to talk to Ron Grant. He's sitting in for Sean Rose this evening with the stories making the news this week. Ron, good to see you, my brother.
Good evening, Ed Drinker. How are you doing? Good evening, ladies and gentlemen.
Yes, everything's cool. What's up? What's the big stories?
Everything's good. We have quite a bit of few stuff going on in the public, but tonight we're going to be focusing on the NHI, the National Health Insurance Policy. We've had a lot of persons in the general public taking to social media, Edwinka, and voicing their concerns, more so in against it, but I think it's imperative that we give them a quick update on what's being going on. Okay?
Yes. Well,
now, a lot of the stuff that we see are a lot of people voicing concerns in reference to them thinking that, or them being concerned about it being pressed upon them, it being mandated that they do. A lot of people would like to know, well, you know, why is it that we can't just offer NHI to the persons that don't have insurance? But as we know, it's not quite that easy due to the BVI population. That is not going to be enough to sustain the project. So it has to be a universal health insurance plan. And that's one of the things that we've been trying to get across to the general public. Most recently, we took to the streets and we spoke to Mr. Shawande, who is actually right now spearheading a petition against the NHI, and this is what he had to say, so check it out.
Well, the National Health Insurance Plan, it's commendable for trying to insure people who are currently uninsured, which the Insurance Association of the BVI estimates to be about 40% of the population. But the problem with the plan is because it makes contributions mandatory, many people who are being currently insured through their jobs with private insurance will most likely lose that private insurance because the employers won't want to pay twice for covering their employees. And the private insurance that they currently have, the 60% of the population, the private insurance they have is superior to that of the NHI because it's global in coverage. It gives you more monetary value. The Insurance Association and the BVI also said that it's actually even cheaper when compared to the 7.5% of the NHI, except for a few categories of people, maybe people making minimum wage.
What we see, Edwinka, is that it's not that the information has not been forthcoming. The government, in its best effort, has been providing information as we go along to inform the general public. And you can tell me if I'm wrong, but what I think we see now are persons are only now beginning to sit back and take a look at the material. So along the way, we're coming up with some misconceptions.
Yeah, I'm noticing, Ron, that there are a lot of information is going out that is, because it's quite inaccurate actually.
Very much so, yes.
According to the research that's been done over the past 10 years, there's about approximately 60% of the persons, according to the health economic unit of the University of the West Indies, about 60% of the persons in the Virgin Islands are without insurance, without coverage. We have a situation where actually NHI is comparable to the other insurances in terms of benefits package. Insurance companies have limits. NHI has a $1 million lifetime limit. Some insurance companies have $1 million. Some have $2 million. One of the things about NHI is that you have a safety net in social development, for example, public assistance. If it happens that you have reached your limit, if you had a long-term catastrophic illness and you reach your limit, then of course you can apply for assistance from government, which you cannot do with private insurance. And if you overran your limit with private insurance, then they will drop you, and then you can still come to the government for public assistance.
Correct.
So that's one thing that needs to be said. Cheaper. First of all, the individual being insured is paying 3.75%, the employer is paying 3.75%. It certainly can be cheaper.
Right.
When you compare it to programs or policies or plans that insurance companies like Bupa has, for example, you see that on the low end, on the extreme low end for a single person with no children, Bupa is $52 a month. With NHI, for a minimum wage person, their cost will be $24 a month. So it's half of what Bupa charges, and you don't pay more than $252 a month presently as a maximum. So it certainly is not cheaper. You have global, just like how other insurance companies have networks all over the world. NHI has networks in the countries that we normally go to for health, in Puerto Rico, in Miami, and in Florida. We have agreements with those hospitals in those areas.
Right.
But the real goal of NHI is to provide everyone
Correct.
with insurance, with affordable access to health care. And if you can't have those persons who are the sickest, need insurance the most, can't afford health insurance, to just be dumped on the government, while the insurance companies
Correct.
get all the young people that don't that's working, that don't get sick, and just pay insurance company their money, don't make any claims, and the insurance companies get rich, and we have the majority of people that's uninsured and
Exactly.
don't have access to quality health care. So the NHI is about having access, universal access to quality health care for all the residents, all the legal residents of the Virgin Islands. Your minimum payment is $24. Your maximum payment is approximately, at this time, $252. And you have a wide range of coverage, just as the insurance companies
Got it.
provide. So,
Right.
you know, I think if you're going to be against it, you need to have the facts straight.
Sufficient information. Well, the Honorable Minister, Ronnie Skelton, and the Government Information Services again continue to provide information to the general public. Just recently, a press release was sent out, one outlining the cost and sustainability of NHI, and the second was its long-term social and economical benefits. So, as I said, the information is definitely there. As a general public, though, it is very much imperative that we look at that information for ourselves and understand that it is for the greater benefit of the Greater Virgin Islanders, to ensure that all persons are equipped with health insurance. One of the things that we need to look at Juinka, is you must remember that our statistics, when Mr. Roy Barry was also on your show, stated that 60% of Virgin Islanders are insured. Am I correct?
60% of Virgin Islands are uninsured.
Are uninsured.
Uninsured, yeah. And that figure came from the research did by the team of Dr. Carl Theodore of the University, the Health Economic Unit
Correct.
of the University of the West Indies.
Now, in Dr. Theodore's research, he also noted that many of the other Caribbean countries have national health insurance, and they have been doing quite well. When you look at the insurance companies, those who are saying, the persons who are raising speculations on there are going to be the loss of jobs and all that kind of stuff, one almost wants to wonder, Edjuenka, if, for lack of a better phrase, we have local agencies in insurance now tooting horns because this health services, national health insurance is coming to effect, and they now feel a little bit threatened.
Well, there's room for coexistence of both the private health insurance providers and the NHI in our attempt, in the attempt by the National Health Insurance officers to work harmoniously with insurance companies. They demonstrated the spaces where with creative planning insurance companies can actually thrive in the market where NHI exists, and
Right.
and insurance companies in Cayman, in many of the other countries where Turks and Caicos, many other countries where there are national health insurance, there are no reports of insurance companies going out of business or
Right.
insurance companies laying off anyone.
Because they now more than ever have an opportunity to be competitive, you know.
Well, they can be creative with some plans. For example, the co-payment. Sometimes, if you have a catastrophic illness, you might have a major surgery that costs a considerable amount of money, and as a poor person, you may not be able to foot the bill for the co-payment.
Correct.
A supplementary plan from a creative insurance company would be able to assist you with paying that co-payment. So there are spaces for cooperation between the private insurance industry and the national health insurance.
Well, Adjoinka, the Honorable Minister, Mr. Mark Vanterpool, spoke about the claims by the insurance companies, and we're going to go to a clip to listen and to hear what he had to say.
You know that the health insurance in the world today, they're all dodging and ducking. I heard them talking in the news. They're dodging and ducking, paying out for health insurance bills as much as they can. And you know that when you go, and this year you have some situation that you can't handle, or you know that you have some disease that you have just discovered, or you know that you have just seen a lump in your breast, or you have just been told by the doctor that prostate is on the way, and you know that when they discover that next year your health insurance is either denied or the premium is seriously increased. You know how to operate.
Well, as we wrap up, Adjoinka, we want to give the general public, as we said, way to understand what is being, the information that's being propelled. There are lots of information, the NHI website, as well as many brochures. So don't feel neglected, ladies and gentlemen. There is information for you to go and research, and we want you to understand education and awareness is important. So and
thank you for that report, Ron.
Absolutely.
The website for NHI is vinhi.vg. vinhi.vg, and I just want to pick up on something that Mark Vanterpool was saying, and is that NHI is from the cradle to the grave. You won't get dropped if you get sick.
Correct.
And your premiums won't go up if you use if you use insurance and you have to claim benefits. So.
And at the end of the day, this is an approach to make sure that all Virgin Islanders are taken care of. They have sufficient health, go to the doctor with no problem. So this is for, the betterment of our territory. So you guys check it out.